it's really exciting to finally see something different. This is a great breakthrough to see a new therapy for CLI that actually is sustainable for up to 6 months. CLI and CLI patients struggle so much with their disease to the point that sometimes we have to repeat interventions on these patients almost every 6 weeks to 3 months or so. And now finally we have data to show that there is patency difference between the Lutonix drug-coated balloon and the plain balloon angioplasty all the way up to 6 months. So it's extremely exciting for me and my patients to be able to give them something that they can keep them out of going back for secondary procedures up to 6 months. So this could not be more exciting times for us physicians that deal with CLI. The indication of and implication of these findings and the utilization of drug-coated balloons, specifically the Lutonix drug-coated balloon, as the time comes, it's definitely going to change the landscape around, because now, for the first time, you have a new therapy for CLI. Because if you look at the historic events over the last 15 years, for instance, there hasn't been anything new that we can use with confidence that we can depend on that the vessel or the CLI patient is going to be free from events for 6 months until now. So with that, the landscape or the algorithm approach to therapy for our CLI patients, it's going to be starting with the Lutonix DCB first to give them that benefit that we're seeing in the trial. These were not, simple, straightforward patients. Whenever you mention the word critical limb ischemia, you always have to think about all the other elements that come with it, which is we call comorbidities. So they had a lot of it. And in the Lutonix BTK trial, one of the things that really helped us understand the value of the Lutonix BTK balloon is the fact that we have 56% of our patients have Rutherford 5, which means that they had a wound of some sort. And having a wound on the foot is really a bad sign for things to come. So if you can actually stop the wound or cause a regression of it, it's a great thing. So in that regard, I would see that the patient population that we treated is a complex patient population. And despite that, we still had a great separation in terms of the Lutonix DCB versus the balloon showing benefit as early as 4 to 6 weeks, and it was sustained 6 months. So in the past, there has been some concern with the use of drug-coated balloons below the knee. Now with the Lutonix BTK results, we have found a safety point that is just equal to the plain balloon angioplasty. There's no difference between the two. So finally, we can actually put this to rest, that the safety element of the Lutonix DCB below the knee has no negative connotation associated with the use of it, which is great for us as physicians. It's great for our patients. So now physicians that have access to the Lutonix balloon, they can start using it based on the randomized controlled trial that we just presented here. The Lutonix 14 DCB is an appealing option to use in the BTK vessels because of, one, its safety element. It's been shown to be extremely safe, just as safe as using plain balloon angioplasty. So having said that, then the efficacy of it, showing a difference in terms of outcome, starting at 30 days, you can see the separation between the two, where the drug-coated balloon, specifically the Lutonix drug-coated balloon, start to show superiority versus the plain balloon at 30 days. And that is sustained all the way up to 6 months. And that is what we discussed here this year at VIVA 2018. So extremely exciting to be able to show that, share that, and also say that. We submitted the Lutonix 014 PMA to the FDA, and we're looking forward and hoping to hear from the FDA soon. Speaking for myself, I look forward to having the balloons in my hand as soon as possible. And I'm a bit envious in the most positive way for my colleagues around the world that have access to the balloon because they get to use it now. Now they have a randomized controlled trial that shows great results in terms of safety and efficacy. So they get to use it on their patients. So they're lucky that they have it. They should use it. And hopefully, as soon as possible, we get it to